Hey, it's Dr. Scott at Chiropractic Associates in Long Grove, Illinois. And today I wanted to talk to you about back pain. In particular, I want to talk to you about acute back pain versus chronic back pain and how you can avoid your acute back pain from becoming chronic. Now, we've all had acute back pain. We were lifting something or we had an injury or an accident and our back suddenly hurt. The challenge is we want to repair that without it becoming chronic, without it lasting longer than 3 months. And unfortunately, this long-lasting back pain becomes all too common. And a lot of times it's of no fault of our own, but it's because of maybe some advice that we got that was inaccurate. So we want to prevent the acute back pain from becoming chronic. And the way to do that is we want to avoid getting what we call non-concordant care. Basically, you want to get the right recommendations about how to take care of your back pain. So we want to avoid the non-concordant care and the non-concordant treatment recommendations. There was a fairly recent study done that found that half of the respondents who had moved from acute to chronic back pain got poor advice within the first few weeks of their problem, and many times from their family doctor. So what would be an example of non-concordant care? One example of non-concordant care, basically what works and what to avoid, is early opioid intervention. Just because you have pain does not mean that you qualify for opioid care. Opioids don't fix problems. They don't improve functionality. They don't improve biomechanics. All they do is block pain. And if you take them long enough, all they do is promote addiction. So simply being recommended pain medication for your back problem is a big problem. Or hurrying right away to pain management and getting an epidural when you haven't done anything to improve movement mobility. You haven't done anything to improve strength. Just, I need an epidural. Non-concordant care that leads to chronicity, does nothing to improve activities of daily living, does nothing to improve functionality. Needless imaging like an X-ray, an MRI, or a CT scan. Hurrying right along to get an MRI because you have back pain is an example of non-concordant care. Now, there are certain reasons to do that. They're clinically based. You have radiating symptoms down your leg. You've lost bowel and bladder. Maybe this is a chronic third or fourth time with which you've had this problem. Okay, or there's a history of trauma. You have a history of cancer. If you don't have those things, however, simply getting an X-ray is an example of non-concordant care that might lead to chronicity. In fact, there was a study done that there was a significant portion of people that got chronic their problems advanced chronically by simply knowing that they had arthritis in their back. The group who had arthritis in their back but didn't know it because they didn't take an X-ray, they did better than the group who knew they had arthritis in their back. So simply getting an X-ray does nothing to improve the outcome. It just gives the doctor maybe some more information. Muscle relaxers. Muscle relaxers are an example of non-concordant care. They don't work. They don't do anything for you. They sound nice. They sound lovely. My muscle's spazzing. If I relax the muscle, maybe you'll feel better. It doesn't work. Instead, you want to do things like movement therapies, things that improve your function, that get you up and moving. Motion is medicine, okay? The goals of the care, your symptoms are improving over time. Maybe they're not improving as fast as you'd like, but your symptoms are improving with care, with movement therapies like chiropractic care, exercise physical therapy, and then doing some basic mobility type of work, getting you walking again, getting you moving again, getting you stretching again. These are examples that will help you out of the acute care situation that will avoid the chronic care situation. If you've got additional questions, give us a call at Chiropractic Associates in Long Grove, Illinois. We'd be happy to assist you if you have an acute back problem, and even happier to prevent it from becoming a chronic problem. But be careful, be cautious, make sure you get the right advice right out of the gate.